Welcome to the Mental Health Merienda, your snack-sized guide to mental health wellness. I'm Dr. Adeline Leon, licensed clinical psychologist specializing in neuropsychology.
And I'm Michelle Young, licensed clinical social worker.
So for this episode, we'll be discussing depression, types of depression, risk factors for developing it, and common symptoms, and also how to cope with it. And since we recently transitioned to daylight savings time here in some parts of the US and other parts of the Northern Hemisphere, you or someone you know might be experiencing what's known as winter blues. So that describes depressive symptoms that are associated with the shorter days and longer nights.
But many individuals experience depressive symptoms regardless of what season it is. So when we're talking about depression, we're talking about a mental health condition that negatively impacts how you feel, the way you think, and how you act. And it can also lead to a variety of emotional and physical problems, and it can decrease your ability to function at home and at work. And that's the key here when we talk about diagnosable mental health conditions, is that it's affecting your functionality. So it prevents you from going to work. It prevents you from going to school. So that's the key thing that we want to point out here. So something to keep in mind is depression is more than just feeling sad. The diagnosis is actually called major depressive disorder. And to be diagnosed with this, a person must experience symptoms of depressed mood or loss of interest for most of the time for at least 2 weeks that interfere with their daily activities. And we'll talk more about symptoms as we go through this episode.
So in this episode, we'll be focusing on major depressive disorder, but we just wanted to acknowledge that there are different types of depression, and they can develop due to specific circumstances. So some common ones include a persistent depressive disorder. This used to be called dysthymia or dysthymic disorder, and that consists of less severe symptoms. It's more of a mild depression, but it lasts much longer. So it lasts at least 2 years. Another type of depression, which is perinatal depression. Most people are familiar with postpartum depression, but perinatal is anything that's associated with pregnancy. So it could be a depression that begins during pregnancy, which will be prenatal depression, or depression that begins after the baby is born, which again is postpartum depression, which most people are more familiar with. And then also what I referred to at the top of the episode is seasonal affective disorder, what I referred to as the winter blues. And so that's a depression that comes and goes with the seasons. And the symptoms typically start in late fall. So just recently when the time changed, late fall, early winter, and then they go away during the spring and summer seasons.
So according to the World Health Organization, depression is the leading cause of disability worldwide. So globally, there are more than 300 million people of all ages who suffer from this disorder. So here in the United States, data from SAMHSA, so SAMHSA stands for Substance Abuse and Mental Health Service Administration. In their 2021 data, they found a couple of things. The prevalence of a major depressive episode was higher among adult females, so 10.3%, compared to males at 6.2%. And then in terms of age, so adults ages 18 to 25 had the highest prevalence of major depressive episode at 18.6%. In terms of ethnicity, we see the highest prevalence of major depressive episode among those who report having multiple races, so 2 or more, and that's at almost 14%. And then in these statistics, Hispanics make up 7.9% of those reporting depression. But in this study, they were also able to identify their race. So some identified as white, some identified as Black. So that may have affected the statistics for this group.
And so when we think about depression and who it impacts, which now we have an idea of how it's impacting people, at least in the United States, I think it's helpful to really know what some of the symptoms are, because not all of them are obvious. They're not just sadness, like what we see in commercials for antidepressants. Although persistent sadness is definitely one of the main symptoms, but it's not just sadness, it's an emptiness. It's an empty feeling. So sometimes what you see in people with depression is that they don't even necessarily feel sad. It's more of just, I just don't feel much of anything. It's a numbness, not really responding to things. Feelings of hopelessness or pessimism, feelings of guilt, worthlessness or helplessness. So it's not just that feeling down, it's that thought of things are not going to get better. This is terrible. I'm horrible at this, and I don't see a way out, and I don't see how this will get better. Loss of interest or pleasure in hobbies and activities, that's a big one that loved ones can notice.
And definitely a big one with children, and we'll get into that a little bit, but children and adolescents, that's a huge one. in my opinion.
Yeah. So if you see someone who used to enjoy gardening, used to enjoy reading, and now they just don't want to read anymore, I just don't really feel like gardening anymore. I'm just not really interested in it. That's a key there as well. Decreased energy, fatigue, or feeling slowed down. And so, something else that's good to keep in mind is that depression also causes several physical symptoms that would be difficult that you would never think are related to depression. So, along with that decreased energy and fatigue, you can also have difficulty sleeping, changes in appetite, and unplanned, that's the key there, unintentional weight changes, and even physical aches and pains, digestive issues. But along with those more physical symptoms, you can also see some cognitive symptoms too. And in my job as a neuropsychologist, I see this very often. I have patients come to see me who are concerned about having cognitive impairment and potentially a dementia process. And sometimes I'll say that your cognition seems fine. I think it's related to depression because depression causes poor concentration and also that slowing, that feeling slowed down, feeling sluggish, that fatigue, and really like you're moving in slow motion almost. It could feel that way and it could even look that way.
Right. And I think too, there's that misconception that, there's like laziness attached to depression, and it's not laziness. I mean, there's, as you're mentioning all these symptoms, there's a physicality to this disorder where, like you're saying, you feel slowed down. It's impacting some of your cognitive abilities, your ability to function day to day. So definitely in terms of ending that stigma, understanding what all the symptoms are of depression, not just the sadness, right?
Yeah, and I think also, lastly, it's important to note that thoughts of death or suicide, that's a very important symptom that can come up as a result of that hopelessness and that helplessness that you're feeling. So,
Yeah. So when we're talking about what depression can look like, specifically in the younger population, so children and teenagers, the symptoms can look a little bit different. So in young children, you might see clinginess. That's a big one. Reports that they're feeling aches and pains, or that their stomach hurts, they have pains in their body. You might also notice difficulty concentrating, refusing to go to school. So that's a big one, especially for preschool age kids. I think sometimes people don't realize that a young child could experience depression. Not wanting to go to school, not wanting to see their friends, or not wanting to socialize is one of the symptoms. And then also changes in their appetite and weight. So those are some key ones that you would see in a younger child. And again, we're not saying that, there's one day where they're feeling clingy or they're not wanting to go to school. We're talking about over time. So as we said earlier, there's like a 2-week period, so to speak, where there could be that episode of depression.
yeah, I think that's really good to keep in mind for parents, especially that clinginess, because I feel like that's something that parents could find maybe a little irritating. Like, oh, why don't you go to school? You were fine going to school. Why are you so clingy now? But instead of just being irritated, really think about the possibility that your child may have some depressive symptoms.
And two, this is something that's like a change in their normal behavior. So this is not typically how they are. And so some of these things are happening. That's not, how they usually are. So also kind of just paying attention to, their day to day, how they usually operate. And then when we talk about teenagers, so some things we might see in a teenager who might be struggling with depression, you would see irritability. And I know sometimes with teenagers, irritability might be kind of hard to
irritability in a teenager.
What? What? Can't suss it out. Is it irritability, like regular teenage angst, or is it depression? But again, like this is something that's more so than they normally are. So something out of the norm. Also anger, sleeping more than usual. So part of that would be because they don't want to talk to other people. They don't want to have those interactions. So being socially isolated. Also poor performance or poor attendance at school. So skipping school, not wanting to go to school. When again, maybe before they were a really good student, they were going to school just fine. And now that's like a marked change in their personality.
I think that marked change, that's the key there, is that marked change.
Exactly. Again, and some of these might sound like your typical like teenage angsty behaviors, but different from how they normally operate. So feeling extremely sensitive, like you can't say anything without them getting irritable or getting angry. And then also a thing that we see that's common is using recreational drugs, using drinking as a way to self-soothe and to cope. You might also see self-harm happen a lot with teenagers. And then this is also one to pay attention to as loss of interest in normal activities. So if my child used to be really into sports, they used to play basketball regularly, and now they're not doing that anymore. So again, that marked change that we see as their baseline. And then also avoidance of social interaction, which that can go in line with not wanting to go to school, not wanting to spend time with their friends. So you're seeing this this change in their personality. And I think too, another big one is that social isolation. So normally, your child had friends, they're always talking to their friends. I mean, sometimes that's like the big thing where they're always like texting and talking to their friends. And now you're noticing that they're not. They're in their room, isolated. They're not talking to anyone. They're not texting anyone. The friends that they used to talk about, they're no longer talking about. So I think those are things to pay attention to as a parent if you think, your child might be struggling with something, with depression or any other, mental health condition.
When we think about the word depression, oftentimes it's used interchangeably with sadness. So someone might say, oh, I'm feeling kind of sad, when really they're referring to depression, or vice versa. But I think it's really important to differentiate the two. So sadness, it's a temporary emotion. It's usually triggered by a disappointing or stressful event. So let's say you're going through a stressful divorce, you lost your job, you had the death of a loved one, and very understandable. Bereavement and grief and sadness are very normal reactions to that. In other words, it has a specific trigger. In most cases, these feelings, they also tend to ebb and flow, and they respond to input and changes. That's a key. And so even if it is in response to some certain situation with sadness, if the situation changes or it improves, the sadness fades. Versus depression, like I was saying, it's an ongoing mental health disorder. It's pervasive and can result in a loss of motivation, loss of interest in activities. It can drastically impact all aspects of your life functioning. That's a key there. Impacts your relationships, your family, your job, everything. And one key difference, again, is that depression, this isn't always the case, but oftentimes it doesn't really have much of a trigger. And even people who seem to have ideal lives, oh, you just got married, oh, you just got this job, you just moved, everything seems great, and they can be depressed.
Right. And I think too, we see there are, celebrities or people who are famous who talk about struggling with depression. So just being, wealthy and beautiful doesn't stop you from experiencing this. So like you said, you can have an ideal lifestyle, but still struggle with depression. And it might not have that identifiable trigger, like we were saying earlier.
Yeah. And I think that's why, and people, they have good intentions, but for someone with depression to tell them, oh, but you just won this award, or oh, you were just voted employee of the month, or but oh, you lost 50 pounds, you look great, why are you depressed, or oh, it's everything, just cheer up, it's not helpful.
Yeah. So even though depression is a pervasive disorder that does require treatment in some cases, a study included data of nearly 300,000 people from the source called UK Biobank, and they identified 7 lifestyle habits that can help cut the risk of depression by 57%. So pretty significant.
That's a high number. Yeah.
Right. And I think these 7 lifestyle habits, we've talked about it before, some of these in our anxiety video, which if you haven't seen that, make sure to check that out. But these 7 lifestyle habits, I think, are helpful for cutting the risk of depression, but also for other mental health conditions. So we'll go ahead and list those. So the number 1 here that we're going to talk about is sleep. So making sure we're sleeping at least 7 to 9 hours per night on average, that can help reduce the risk of depression in adults about 22%, according to this study. So pretty significant, in my opinion.
That is, yeah.
Yeah. And easier said than done. I struggle getting enough sleep. But prioritizing your sleep is definitely something that in general is helpful for helping your mental health. And then another one that's a big one, and I think we talked about this in our anxiety video, but exercise. So exercise is excellent for cutting, reducing the risk of depression and also anxiety and other mental health conditions. And what this study had found was that physical activity had more durable effects than antidepressants. Although with antidepressants, the medicine tends to work faster in helping to treat depression, but exercise, over the long term, works just as well.
Some other tips: healthy diet, specifically a Mediterranean slash or mind diet. The mind diet is a combination of the Mediterranean diet and the DASH diet for hypertension. And then limiting alcohol, which that makes sense. According to the CDC, the maximum daily allotment, so this is not a recommendation, but it's the maximum allotment that people should be drinking per day. For men, it's 2 serving sizes per day. For women, it's 1 serving size per day. This is, of course, assuming that you do not have any other health conditions that are that may be impacted by alcohol use. And so a serving size is only 5 ounces of wine. It's only 1 can of beer, and it's much smaller than you would think.
Yeah. So, some other tips, and again, these are, I think, obvious to all of us: avoid smoking. So, I think we know in our society there's a lot of evidence that smoking, tobacco, even like vaping, not healthy. It's not a healthy habit. There are a lot of programs out there, even apps, to help you to stop smoking, to help you quit. But smoking in general is not a good habit, and again contributes to depression. So not smoking, cutting it out of your lifestyle is something that's going to be beneficial. So limit sedentary time by cutting down on screen time. So this study in particular found that long periods of being sedentary are an independent risk factor for depression, independent of how much exercise you're getting. So, for a lot of us, we might have desk jobs. We are sedentary for a good part of the day. So being mindful of that, getting up and moving your body. I think we talked about earlier how important it is to movement and, physical activity we said earlier. So trying to cut down on as much of sedentary time is also something that's beneficial for reducing the risk of depression. And then lastly, cultivating friendships and social connections. So in this study, actually in another study published in Nature Medicine, based on surveys of people in 16 different countries, they found that people who are 65 and older who have hobbies reported having higher life satisfaction and having less depression.
But if you're at a point where you feel that you may already be experiencing symptoms of depression, you do have treatment options. First one that I'll mention is something you can do on your own. It doesn't involve seeing any kind of uh, medical or mental health professional, although it can be used to address more mild depression or in conjunction with psychotherapy and or medication, and it's called behavioral activation. The idea behind it is that if you practice certain enjoyable activities, it can activate a positive emotional state. And so the activity itself, it becomes self-reinforcing and it helps break down the cycle of depression. So what happens with depression is that you have lowered motivation, lots of fatigue. Let's say you enjoy, I'm not sure why I keep going back to gardening. I'm not a gardener, but for some reason I keep going back to the idea of gardening.
You should go try it.
I don't have much of a green thumb. My husband's the one with the green thumb in the family. I'm the one who kills the plants, but let's just use that example of gardening. If you enjoy gardening and you're feeling depressed, you have lowered motivation, you just don't feel like going outside, you just don't feel like thinking about it, you don't feel like physically getting up and doing it. But if you push yourself just a bit, and it can be really hard to push through that inertia, to push through that feeling of, I just can't do it. It can feel like a wall in front of you. But if you can just push just a little bit to get through that, and then let's say you do go out and you do some gardening for, if you normally would have done it for 3 hours, you can aim for just 15 minutes. But in that activity, while you're enjoying that gardening activity, then that also helps you feel better. And then that helps break down that cycle of that lowered motivation and not feeling any pleasure in activities.
Yeah. Actually, I have a non-gardening example for someone someone that I treated. So for someone that I treated cooking, that was something that was very important to this person. And they started off with, just starting to cook, one meal a day. They used to cook a lot more, and then slowly going up and cooking like longer, maybe more elaborate dishes and things like that. And that helped them get out of that cycle of depression, like you're saying earlier. So incorporating something that they already love, that they enjoy doing, they love doing it, help them kind of take themselves out of that cycle.
No, that's a great example. And so antidepressants, medications that are commonly prescribed to treat depression. If you are feeling depressed, oftentimes what can be helpful is to first speak to your primary care physician about it. They tend to be the first point of contact. And so they can either prescribe medications themselves, or they can refer you to a psychiatrist or refer you to psychotherapy, or both. And so antidepressants, they also take time to work. It can be up to 4 to 8 weeks to work. They're not instant. And you can tend to see first. So in the first couple of weeks, what you will be more likely to see are changes in more of those physical symptoms. So changes in sleep, appetite, concentration abilities. And so you tend to see those improve before you see your mood lift. And so it's really important to give medications a chance to work.
Yeah, definitely. That 4 to 8 weeks, like you're saying earlier, is really important to keep in mind because sometimes I think we're taking something, so we expect it to work right away or to see a change right away. And sometimes too, if this is your first time being on antidepressants, your doctor wants to kind of keep you in that, 4 to 8 week period before they decide to switch medication. So it is something that's going to take some trial and error and take some patience. And I know that can be really difficult because you do want like immediate effects, but definitely listen to your medical provider. Don't stop. Don't switch it up. Don't try other people's medications just because it worked for them. I mean, it's really important in this process, especially in the beginning, to kind of wait and be patient. There's a reason that they make you wait, and they want to wait and see if it's working or not working.
Yeah. And this is a very important point, and so it's worth repeating. Never stop taking an antidepressant without discussing it with your doctor first. You can have very serious effects from suddenly stopping a medication. So most medications you need to be tapered down, meaning that the dosage is slowly reduced until you are no longer taking it. And it needs to be under medical supervision. So your doctor needs to know so that they're aware of it and so that you can call into the office if you experience any side effects. That's very, very important. Another thing that people are often very concerned about is, I don't want to take this medication forever. I don't like medications. I hate taking medications. I get it. I think for all of us, we would rather not take any pills if we never needed to. But with taking an antidepressant, it does not mean that you will be taking it forever. Oftentimes what can happen is that a primary care, for example, can prescribe an antidepressant for someone who, let's say, their spouse died. Obviously, a very terrible experience, and bereavement and grief is very normal with that. But if that bereavement and grief starts to make it a bit hard to function, for some people, they might benefit from taking an antidepressant for maybe 3, 4, 5 months. I'm just giving just a random time period for just a temporary period of time. And then they're tapered off and they don't need to take it anymore. Other people, if they have more of a clinical depression, they still won't necessarily need to be on an antidepressant indefinitely, but they may require it a bit longer as part of a more long-term, in-depth treatment plan. And so, in other words, they are not habit forming. They are not meant to be taken for the rest of your life, not necessarily. Just make sure that you speak to your doctor about it, I think is really the point that I want to make with that.
Yeah, those are all good points and all important.
Yeah. And so for some people benefit more from psychotherapy or a combination of psychotherapy along with medications. But you've heard us mention this before. Cognitive behavioral therapy, we'll continue mentioning it. It's evidence-based. It's a form of therapy focused on helping a person to recognize cognitive distortions. Cognitive distortions are maladaptive thinking patterns, and they are in response to things that happen in your environment. And so the goal of CBT is to help you recognize these cognitive distortions. And when you recognize them, then you can learn ways to change them. And so that's known as cognitive reframing. So the goal of it is to lead to a change in behavior. So you think about cognitive as the C, cognitions lead to behaviors, that's the B. And then with that therapy and changing those distortions. And so in many cases, you can see significant improvement in just 10 to 15 sessions. But another type of therapy that can be very helpful is interpersonal therapy, which focuses on more interpersonal events, interpersonal life events, and how they impact your mood and vice versa. So that back and forth relationship between the two. And the goal of interpersonal therapy is to help people improve their communication skills within their relationships, and then to help them deal with different crises and issues that may contribute to worsening their depression. So essentially, it's to help with developing more helpful coping skills to help you deal with stress in daily life.
Right. And I think one thing I just want to point out too is if you're trying therapy for the first time, also give it time, give it some patience. And, if one therapist, isn't a good fit for you, then maybe someone else might be a good fit. That's also something I think people shouldn't just give up on if they have, one, maybe not great experience. I think we mentioned this in our anxiety video is sometimes it could take a couple of tries to find someone who's a good fit for you. So that's also something, don't, give up on therapy, because therapy does, help, especially with something like depression. So for people with depression who are not seeing significant improvement with medication and or talk therapy, there are other alternative treatments that are FDA approved and also involve something called brain stimulation therapy to help treat the depression. So again, this would be after you've already tried medication, you've tried therapy, you're doing both, and you're not seeing improvements. So there are some alternative treatments out there, but again, definitely consult with your physician.
I think it's the minority of people who end up needing any of these treatments.
Yeah. So one of the treatments is called electroconvulsive therapy, or ECT. So ECT has actually been around since the 1940s, and it's a pretty well-known brain stimulation therapy. So what it involves is brief electrical stimulation of the brain while the patient is under anesthesia. And the intention is to stimulate parts of the brain to help activate it. What this is not, it's not like, kind of like being electrocuted or something, again, some negative images that come to mind with the media or with movies where it makes it sound like, really scary. That is not what this is. And again, under the supervision of a medical professional, this is, safe and FDA approved. So again, a very common alternative treatment if medication and therapy is not helping. And then another alternative treatment is something called transcranial magnetic stimulation, or TMS. And TMS uses magnets to activate parts of the brain. So instead of electricity, like with ECT, or electrical stimulation like ECT, transcranial magnetic stimulation uses magnets. So again, it's also something that is going to be probably done in conjunction with medication and therapy. And again, it's an alternative treatment. And then the last one, and this might be some that people are hearing about a little bit more often, is something called ketamine treatment. So ketamine is medication that's delivered through a nasal spray under medical supervision. And what it does is it actually works really quickly. It can be done within a couple of hours, and it's going to be used in conjunction with your oral antidepressant medication so that you can see improvements in your mood and in your functioning.
But just remember, if you are feeling depressed, there are many treatment options available for you. And if you're ever feeling hopeless and having thoughts of suicide or self-harm, there is help out there. You can always call 911 988, which is the suicide hotline in the United States, or your local crisis hotline.
Right. So that is all we have for today's episode about depression. So again, I'm Michelle Young, licensed clinical social worker.
And I'm Dr. Adeline Leon, licensed clinical psychologist.
So if you enjoyed our show on depression, you found it informative, and you want to see more content like this from us, make sure to like this video and also subscribe to our channel so you can get notifications when we upload our weekly episodes.
And we hope you gained some helpful information. Thanks for tuning in to Mental Health Merienda, your snack size guide to mental health wellness. See you next week.
All right. Bye.